Hey everybody, it is Mike, 55 years young, along with Denise, 54 years young. Let's talk about Alzheimer's and dementia. Who wants to talk about Alzheimer's and dementia? Who wants to know how to actually potentially reverse Alzheimer's and dementia? Did you know that's possible? Did you know?
I did.
You did, yeah. Well, that's what we're going to talk about. That's our topic of the month for our health optimization clubs. Now, how can you join us for this discussion? A couple of things. Let me tell you how it's going to go. We work with our nonprofit, aPlantBasedDiet.org, and we are doing, exclusively health optimization events. And this is going to be a hybrid event. It's going to be local, or it's going to be online. It's going to be totally free, of course. See if I can. Okay, there. Fix the lighting. And we're going to do this for the month of March. It's going to be our topic: Alzheimer's and dementia. How to potentially, or even likely, reverse it. Now, how can we say that, Denise?
It's based on a study conducted by Dr. Dean Ornish that completed last year. Mike did a video about it, reviewing all of the pillars of lifestyle medicine, of the trial and how it went and what the outcomes were, and that they were really good. So not only is it preventable, but it's also in its early stages haltable and reversible. And we'll talk about it at our next potluck, both online and in person.
Yeah, so here's how we can do this. If you look down at the description of this video, you will see a link to my video where I read the entire scientific study. This is a scientific study. This is not like, we think this might work. They actually show you what they did. They go through it in detail, and I read everything, and I give you my comment, my kind of like review and comment on the whole scientific study. It's the first scientific study I ever read, but this is so important because most people don't even think this is possible. Like we've seen posts in our groups that we do, community groups, saying like, repost this for someone with Alzheimer's and dementia, because this is a terrible, terrible disease that we wish nobody ever got. And we agree. Mm-hmm. And the thing is, these folks don't realize that this is, like Denise said, at the early stages. We're not even sure exactly what that means yet. But at the early stages, it's potentially reversible.
There were tests that he mentions in the study, how they determine whether the person was early stage or not.
Okay, so look down below and you will see the link. We request for you to participate in this, and it's no cost, that you watch the video, and you'll see me reading the study, and it's a long video, and I give my comment, and you'll also see in the description of the video a link for you to go and read the study yourself, if that's what you'd rather do. Because otherwise you can listen to it like a podcast while you're driving instead of some mindless other stuff you may be listening to. You actually listen to a study that tells you how to reverse Alzheimer's and dementia, which is amazing, okay? Like I said, you probably didn't even know that existed, but it does. So that's going to be our topic. So the idea is, if you can, it's kind of like a book club, right? Read, listen, watch this video. And then you'll have two opportunities. One, if you're near the Villages, Ocala, Gainesville, Orlando areas, that'll be our first opportunity in March, early March. The event is down below, or go to PlantBasedEvents.info. You'll see it there. That's our calendar. And then also late in the month, like the last Saturday of March, I think, in Naples, Florida, Southwest Florida, because we have the Villages Health Optimization Club in the Villages. We have Southwest Florida Health Optimization Club in Southwest Florida. And sorry, we're trying to get back to the lake to see the sunset, and I'm definitely getting my steps in today.
Walking uphill, trying to hurry to not miss the sunset.
You can see the sun behind us. It's starting to set down. We're going to try to see it over the water. All right, so what you can do is, even if you can't be there in person, just go to those events, RSVP saying you will be there, and we'll have a special RSVP that I'm going to add. It will be there by the time you see this, for remote only. All right, so that way we'll know who's going to be there in person. And if you're remote only, the benefit is, of course, you'll get the Zoom link. It's going to be a Zoom meeting. So what we're going to do is we're going to have a discussion about this study. We're going to have a discussion on a different topic every month. It's a new format we're doing. And like I said, you can participate either remotely or in person, but the real benefit, of course, is in person, because you meet like-minded people. You meet people that want to do the best for their health, and you get that support, which is really what's needed, because we know what to do. And it's crazy. You didn't even know that you could reverse Alzheimer's and dementia, but you can. It requires intensive lifestyle modifications. So if it's intense, what does that mean? It means it's going to be hard, right? It's going to be hard.
Yeah, it means changing your habits. And the other benefit about attending the potluck in person is you get to try the food. And for those that are bringing food, please also bring recipes for those that want you to share them.
Yeah, and all of that is in the description explaining the details. And it's better than whole food plant-based. If you heard whole food plant-based, that can mean a lot of things and a lot of unhealthy foods. So we do the 6 pillars of healthy vegan food along with the 6 pillars of lifestyle medicine. That's what we talk about with everything that we do now. So that's a really strict standard, and you'll get to try all kinds of dishes, meet people that are into this stuff. You can just bring cut fruit if you want. You don't have to make or cook anything if you don't want to, because we don't do that.
That's the simplest thing, but you can prepare dishes too. You don't have to just bring raw fruits and vegetables.
Yes, exactly. So hopefully you all get the format, which is anybody can sign up for free. If you're not going to be there, click on when you get a ticket, click on remote only through Zoom, and then you'll get that link. And we'll do it twice this month in March. We're already kind of brainstorming our topic right now for April, which is going to be a good one, I think. And we're going to have the same kind of format where we're going to provide you with the resources to kind of study up. Then we will have our discussion. Remember, this is not medical advice. We are not giving medical advice, but we absolutely recommend you see a doctor that's board certified in lifestyle medicine. Yes. We can maybe even help you find one too.
Yeah, we're not doctors, but we can hook you up with a doctor.
But the fun thing is that you don't need to be a doctor or know anything about science to get these amazing health optimizing results. It's just a matter of changing your habits. And the hardest part is finding like-minded people that are willing to do the same. Yeah. And that's why we're putting this together, right?
Yeah, we hope you can find like-minded people in our clubs, because we sure did at our first potluck that we had a couple weeks ago. There were a lot of people there that had health scares and told us about them, and they told us how they're doing much better now, and they're so thankful that their friends told them about this alternative lifestyle.
Yes, and let me tell you the locations where we're going to be. You already heard the Villages, Ocala, Gainesville, Orlando areas of Florida. We also are in Southwest Florida, which is anywhere from between Sarasota and Naples, includes Fort Myers, Cape Coral, Bonita Springs, Port Charlotte, I guess, Punta Gorda, Englewood, all those places, okay? That's kind of in that area. Now, the other areas we have is Triangle Health Optimization Club, which is in the Raleigh, Durham, Chapel Hill areas. We're going to have one there in person from time to time, because these are areas that we frequent. And then also Northern Virginia, going uphill again, Northern Virginia Health Optimization Club outside of Washington, D.C. And that really is the whole area, but Northern Virginia itself is a giant area, so we just call it Northern Virginia. Sorry, get my workout. And then the last one is a smaller area. And if you're out there, give us a thumbs up. Highland County Health Optimization Club, Highland County, Virginia, where our farm is, off-grid Mountain Ridge Farm, right?
Yep, Mountain Ridge Farm is out there.
So we will have gatherings in all these places. We will have Zoom signups for anybody. So invite your friends, doesn't matter where they are, as long as they have digital service. You can just do it on your phone or anything, right?
Yeah.
So everything is down below. Everything's in the description. If you can't remember anything I said, just go to PlantBasedEvents.info. Is that right?
Yeah, that's our Eventbrite link. You can follow us there and you'll get email reminders about these events.
And if you want to know who we are, go to PlantBasedEvents.info. The reason why is because if you have an account with Eventbrite, which is also free, you will see, actually even before you get an account, how many events we put together through the nonprofit. I think it's like 130.
Hundreds.
Yeah. And then how many attendees have gone to our events? And I think we're well over 30,000 at this point in time. So we're not just some people that are new to this or don't know what we're doing or have no experience.
Yeah. We're not some fly-by-night business. Our nonprofit has been around for over 10 years.
Yeah, that's right. 11 years actually. Yeah. So we're really thankful for the opportunities. This is the kind of work we've always wanted to do since the beginning. And now there's enough people that are interested that we can do this and have these health optimization clubs every month. And, just bring the community together, because that's what it is. That's what it takes, I'd say, is just the community and positive peer pressure, right? Yeah. Positive peer pressure.
Yeah, that's one of the 6 pillars of lifestyle medicine is social connections.
That's it. And also one of the 6 pillars is aerobic exercise, right? Or what do they call it?
Vigorous aerobic.
Well, I call it vigorous aerobic exercise, but just physical activity.
Physical activity.
Yeah, they call it physical activity, which is what we're doing right now. It's part of this, right?
It doesn't have to be aerobic because yoga counts. That's anaerobic.
Yeah, and we're also out in nature, kind of like forest bathing here. So we're getting all of that too. We're checking off all the boxes and surrounded by nature. There's like no human made sounds in these areas, which I really like. I don't know if you're as much of a liker of that as me, but I really, really like that. It's like a therapy.
I like it. Yeah, it's therapeutic.
So that's it. Let us know any comments out below. Share this with everybody you can, and we'll hopefully see you either live or in person in one of those two opportunities in the month of March 2025.
Look forward to meeting you and seeing you.
Bye.
Bye-bye.